Hi, thank you so much for joining me. My name is Trisha Witz with Primetime Health Plan, and today I'm going to go through Primetime Health Plan's 2024 Medicare Advantage Plan information. The goal of the meeting today is just to provide you with an overview of Medicare, how it works, what you can expect in the way of coverage through Part A and Part B. I will discuss how supplemental plans work in addition to Medicare Part A and Part B. Additionally, I will speak about prescription Part D coverage. And lastly, I will talk about Medicare Advantage plans Primetime specific. Here you'll find the Medicare alphabet. Part A and Part B are the original aspects of Medicare. Part A covers hospitalization, skilled nursing, hospice, as well as home health care. And Part B covers outpatient services, such as doctor office visits, emergency room care, and lab services. For Part C and Part D, they tend to be sold by private carriers. However, they have Medicare guidelines that they need to follow. So Part C, also known as the Medicare Advantage Plan, combines both Part A and B and prescription drugs into one program. As for Part D, is just for medication purposes only. When it comes to original Medicare and premiums, for 2023, if you have worked 40 quarters, which is equivalent to 10 years, and paid into the Medicare system, your premium per month is $0. If you've worked 30 to 39 quarters, you will have a monthly premium of $278, and working less than 30 quarters is $506. For Part B, the standard amount would be $164.90 monthly. This is taken from your Social Security check, and if you are not receiving a Social Security check, then you will be billed for this amount on a quarterly basis. There is a term called income-related monthly adjustment amount that if you made a higher level of income, your Part B premium will be increased, which we're going to talk about here in just a moment. The term they use for this is actually income-related monthly adjustment amount, also known as IRMA. And Social Security looks back at your taxes 2 years prior, and depending on how you filed and the income level will depend on your Part B premium. So just for example purposes, we will look at the individual tax return. And if you made $97,000 or less in 2021, the premium in 2023 is $164.90. Above $97,000 up to $123,000, your premium at $230.80. And I'll give you just a moment to review the remainder of the chart there. Additionally, you may be charged more for a Part D prescription drug program. So each carrier tends to have a premium for their prescription Part D. The same income guidelines do apply. So just focusing on the individual tax return, again at $97,000 or less, you're not going to pay anything additional than what the carrier is charging for Part D. If you made above $97,000 up to $123,000, you will pay an additional amount of the Part D premium of $12.20. And then I'll give you just a moment to review the remainder of the chart. When it comes to Part A services, for 2023 inpatient hospitalization, you have a $1,600 deductible that you're required to meet days 1 through 60. Days 61 through 90, you have a $400 per day copay. And days 91 to 150, that copay is $800 per day. For skilled nursing, rehabilitation, physical, speech, occupational therapy, because long-term care is not covered, days 1 through 20 is a $0 copay. Days 21 to 100 is a $200 per day copay, and anything over 100 days is not covered. Home health care, IV medication, physical therapy in the home, covered at 100%, as well as hospice, also covered at 100%. Part B medical services, examples of that would be, again, the doctor office visits, lab services, emergency room, urgent care, chemo and radiation, diagnostic testing, durable medical supplies, outpatient surgery, outpatient rehabilitation, as well as ambulance. For 2023, there is an annual deductible of $226, and once that $226 is met, then Medicare starts to pick up 80% of the claims, and then you would be responsible for 20% out of pocket as a consumer. So the most important question I'm asked many times is it required that I have a Medicare Advantage plan or a supplement? And it is not required. However, it could save you some high out-of-pocket costs simply because Medicare itself, there's no max out-of-pocket as to what you'll pay. So it's important to note that. When it comes to enrolling into Medicare, if you are receiving a Social Security check prior to age 65, then you will automatically be enrolled into Medicare Part A and B, and you'll receive your card typically about 90 days before. The effective date is typically the first day of the month, unless your birth date falls on the first of the month, then it changes. So for example, if you had a birth date that was August 20th, your Medicare is going to begin August 1st. If your birth date is August 1st, then your Medicare would begin July 1st. If you're not receiving benefits from Social Security and you would like for your Medicare to begin the month you turn 65, you'll want to contact Social Security prior to just to enroll, so that will begin for you. And then those that are under 65 that are considered to be disabled, once they're disabled for 24 months, you will be enrolled into Medicare at that time. There are some exceptions to that 24-month rule, and that would be Lou Gehrig's disease and end-stage renal disease, and you would want to contact Social Security to see how soon you could be implemented your Medicare at that time. Now that we've talked about Part A and Part B and what it covers, I like to talk about the enhancement options that are available to you. I find this slide to be very important in information just because as you're getting bombarded with all kinds of mail, it's important to understand the elements that you're receiving and how to separate them. I do believe it helps in the process of elimination while you're choosing your Medicare options. So Medicare supplement plans are identified by letters of the alphabet as well, A through N. Plan G as in George is the one I'll talk about, noting that there are two Plan Gs. One is a high deductible plan, and then there's a standard Plan G. So in the local area of Stark County and surrounding, someone who is 65 years old, Plan G on average is about $130 a month, in addition to the Medicare premium for Part B that we just spoke of. Plan G as in George pays secondary, as all supplements do, to your Medicare. And for instance, if you went to the doctor, went to the hospital on Medicare Part A and B and Plan G, for instance, you're going to show both cards to the doctors, to the hospitals. And for 2023, what is required of you is the annual deductible of $226. And that will obviously change for 2024. And once that deductible is met, that 20% that we talked about a little bit ago is now covered. So there's not much for you to pay outside of your own pocket beyond that deductible, as long as it's a Medicare covered service. When it comes to supplemental plans, you tend to be able to use any doctor, any hospital that accepts Medicare within the United States. Now, some plans may be considered to be a select plan, and if it is a select plan, they generally have providers that you need to stay within. So you want to just confirm as you're choosing your plan options. When it comes to enrollment into a Medicare supplement plan, there are certain times that you would be considered a guaranteed issue, such as when you're just turning 65 going into Medicare, or if you are someone who has been working or your spouse has worked and you've had coverage through the years beyond age 65 and you or the spouse is now retiring and you're losing employer coverage. Outside of that, you can be medically underwritten in a supplemental plan and could be denied. So beyond the medical expenses, Medicare Part A and B, nor do supplemental plans cover your prescription drugs. So that's where you see the prescription Part D entity here under option 1. It takes 3 separate entities under option 1 to complete your healthcare needs. So for Part D plans, multiple different carriers in the local area to choose from. They range, very minimally of $7 and some odd change on up, depending on what you're looking for. We will talk about the penalty later as to why it is important to have a Part D plan, whether or not you're taking medications. And there's plenty of plans to choose from. You just always want to check your formulary, making sure that that plan is covering your medications, which tier it's going to be covered on, which pharmacies you can use, so you have a good idea as to what you'll pay out of your pocket. So then on the right-hand side of option 2, I would call it, are Medicare Advantage plans. And with Medicare Advantage plans, they are actually contracted, subsidized by the federal government, and everything's one-stop shopping. There's the one card that you show to all doctor, hospital, pharmacy visit as you make them, because many of the plans do include the prescription drugs. And you may have to stay within a network versus supplemental plans that are non-select plans. And we'll talk a little bit more about the details of a Medicare Advantage plan as we go along. Just keep in mind that because of the subsidy that they receive from the federal government, the premiums tend to be lower, but you do have co-payments to the doctors and the hospitals as you use the plan. And whether you choose option 1 or option 2, you're going to continue to pay that Part B premium regardless of either that you choose. So as mentioned about the subsidy, what's nice about Medicare Advantage, as outside of the lower monthly premiums, which many of them start at 0, but they offer things such as dental, vision, hearing, gym memberships. Some of them have over-the-counter, as where the supplemental plans, the only additional thing that you'll find typically is like a gym membership through Silver Sneakers or Silver and Fit, something like that. In order to be eligible for a Medicare Advantage plan, you do have to have both Parts A and B. We did talk about the income-related monthly adjustment amount already. And for prime time specific, the service area in which we are approved for would be Carroll, Columbiana, Harrison, Holmes, Mahoning, Medina, Portage, Stark, Summit, Tuscarawas, and Wayne counties. When it comes to prime time, we are considered to be an HMO POS plan, which is Health Maintenance Organization Point of Service. And what that really means is that you need to stay within the network of doctors and hospitals that we have available. And you can certainly check those at www.pthp.com. Be advised that if you're not finding a physician, I encourage you to call into customer service, because they can confirm or verify that the physician you're looking for is or is not in the network. Our plans, you are covered for urgent and emergency care, and that is worldwide, as well as dialysis. Now, the point of service option allows for lab work to be done at any Medicare approved lab except for genetic testing, which typically needs approval, as well as using any dentist for your cleanings. They can either bill on your behalf or you could submit for reimbursement, as well as vision for glasses or your routine eye exam. Now, if you had a medical eye exam, you'd want to stay within the network. So here we are in the 2024 benefits. We do have 4 plans available, and I will just go through the benefit category on the left-hand side and speak to the benefits as we go through so you can compare. And the plan premium, you can see for the basic MA only and ultimate are $0 a month, so there's nothing that you pay outside of your Part B premium. The classic would be an additional $39 a month on top of your Part B premium, and plus would be $89 a month. There are no medical deductible that you have to meet prior to prime time picking up your claims. Now here you do have a max out of pocket. So we talked about original Medicare where you pay that 20% with no max. Here you know right up front what your potential would be in co-payments. So the basic MA only plan is $3,400 a year. The ultimate is $4,300, classic is $4,100, and the plus plan is $3,900. And keep in mind this is per calendar year. There is a Part B buy down for the basic MA only plan, which is a $75 amount that you get back on your Part B, which is very nice. And keep in mind the basic MA only plan is the only plan that we have that doesn't include prescription drugs. So it may be ideal for those who are using the VA and they're getting all their medications through the VA otherwise. When it comes to inpatient hospitalization, there is a copay on each plan, days 1 through 6, and the basic plan is a $275 copay. Ultimate is $310. Classic is $295, and the plus plan is $285. For skilled nursing, days 1 through 20 on the basic plan, you have a $20 copay. As for the other 3 plans, you have no copay days 1 through 20. On the basic plan, days 21 to 39, there's a $150 per day copay. As opposed to the other 3 plans, you have a copay of days 21 to 45. The ultimate is $150, classic is $135, and then the plus is $120. As opposed to days 40 to 100 on basic, that is covered at 100% again, and then the other 3 plans, days 46 to 100, are covered at 100%. For home health care, such as IV medication, physical therapy in the home, you have a $20 copay on the basic plan, and the other 3 plans are $0. Specialist, you have a copay of $40 on the basic and the ultimate plans, and classic is $35 as the plus is $30. For primary care doctor, each plan is a $0 copay except for ultimate at $5. Chiropractic is a $20 copay for all 4 plans. Emergency ambulance transport, you have a $200 copay on basic. The ultimate is $230, classic is $210, and the plus plan is $200. For outpatient surgeries, you have a 25% coinsurance up to $1,200 on basic, $350 on the ultimate, $300 on classic, and $200 on plus. Emergency room care is $110 across the board. Urgent care is a $60 copay on basic, $40 on the remaining plans. Diagnostic radiology, such as MRIs, CAT scans, and PET scans, you have a $250 copay on the basic plan, $190 on the Ultimate and Classic, and $175 on the Plus. Diagnostic tests such as x-rays, ultrasounds, you have a $100 copay on the basic and ultimate plan, $80 on the classic, and $60 on the plus plan. For outpatient rehabilitation, physical speech occupational therapy, you have a copay of $35 on the basic, $30 on ultimate and classic, and $20 on the plus. When it comes to durable medical supplies, wheelchairs, walkers, oxygen nebulizers, CPAP machines, you have a 20% coinsurance, and that's for all plans. For lab work, on the basic plan, you have a $35 copay. It could be 0 to 35, and that's going to be based on if you have it done in the doctor's office, do they send the lab work out? As for Ultimate, Classic, and Plus plan, $0 to $5. And same guidelines, if you have the lab work done in the doctor's office and they're not sending it out, it would be $0. Otherwise, it's a $5 copay. And then therapeutic radiology, so basically radiation, chemo, you pay 20% on all 4 plans. And dialysis is also 20% on all 4 plans. So any of the copays and coinsurances that you have made up to this point throughout the year, it does go to your max out of pocket. As mentioned, they are keeping track of that. And we'll go into pharmacy and formulary information. You can find our Bridge formulary or comprehensive, which is our list of medications, at www.pthp.com. What you may find is that some medications need to have prior authorization for safety measures or quantity limits. And if you are enrolling into prime time and you're on a medication that is not covered on our formulary, you can get a 30-day supply transition fill until your physician can get you on something that is within the formulary. And we do cover some Part D vaccinations as well. When it comes to the day supply, you are welcome to get a 30 or 90-day supply at our preferred pharmacies, and preferred pharmacies save you money in the end versus you can use standard pharmacies as well, but it's going to be cost effective to use a preferred pharmacy, which we'll talk about. We will discuss the Part D coverage stages, such as the deductible, initial coverage stage, coverage gap, as well as catastrophic. We will also discuss extra help and how you can apply through Social Security to gain some help with premiums, deductibles, copays, and coinsurances, and the late enrollment penalty for those that don't have a Part D plan when they're first eligible and they sign up for a Part D plan and what that means. So preferred pharmacy pricing under the Ultimate, Classic, and Plus plans, because those are the 3 plans that do include the prescription Part D. You can see that there's no deductible to meet, and that's across the board. For Tier 1 medications, whether you get a 30-day supply or a 90-day supply, you have $0 to pay in a copay. Tier 2 generics is $15 for Ultimate, $45 for a 90-day supply. As for Classic and Plus plan, both are $8 for 30-day supply, $24 for 90. Preferred brand, which is Tier 3, you have a $42 copay for a 30-day supply and $126 for a 90-day supply for all 3 plans. And covered insulins, you have a $35 copay for a 30-day supply or $105 for a 90-day supply on all 3 plans. And Tier 4 is $95 for a 30-day supply or $285 for 90 for all three plans. Tier 5 specialty tier is 33% across the board as well, and you can only get a 30-day supply in the specialty tier. Now keep in mind some of the preferred pharmacies that we have are Walmart, Walgreens, Rite Aid, Discount Drug Mart, just to name a few. And you can find the list of pharmacies that are available through Primetime Health Plan's website at www.pthp.com. Now for standard pharmacy, again, this would be the list of pharmacies that are not contracted with us to be preferred. You can use them. However, it's going to cost you more. There's no deductible there, but you can see just the difference in Tier 1. It goes from being $0 for a 30 and 90-day supply to $10 and $30 for a 90-day supply. And I'll just give you a moment to look over these copays because they are just a little higher when using a non-preferred pharmacy. Mail order, we use Optum RX, and you can see that the copays go back down. So still a $0 deductible, but Tier 1s go back to 0. Tier 2 for Ultimate is $15 or a $45 copay for a 90-day supply. As for Classic and Plus, is $8 or $20 for a 90-day supply. And I'll just give you a moment to review that as well. When it comes to the Medicare coverage gap or donut hole, there are 4 phases that I mentioned. The very first phase is the annual deductible period, which under Primetime you don't have a deductible to meet. So you would start in the initial coverage stage, which is stage 2. And this is where you're going to pay those co-payments that we just talked about. And while you're making your co-payments, Primetime is picking up the remainder of the costs of the medications. So those two figures together actually is what applies towards the $5,030 amount that's listed there. If your medication cost retail reaches $5,030 for the year, you then go into stage 3, which is the coverage gap or donut hole stage. And in this area, Primetime has taken the initiative to cover our members for Tier 1 and Tier 2 the same way that they were from the beginning of the year. What you'll pay for here is 25% for brand name medications. And if for some reason you would reach $8,000 out of pocket in drug costs, whether that be in your co-payments or that 25%, then you're going to go into stage 4, which is catastrophic, and then you go back to plain 0. And this is also a per calendar year benefit. For Part D low income subsidy, it's also known as extra help. You can apply through the Social Security Administration by phone or their website, and it's to provide assistance with the Part D premium, deductible, co-pays. It will help in the coverage gap. Instead of paying 25%, some people may have a set amount that they pay for that coverage gap stage. And then gives you the ability to enroll or change plans once every quarter, except for the last quarter of the year. And it doesn't matter if you're married or single. With limited resources, you may be eligible. So I just encourage you to reach out to Social Security. It does take about 30 to 45 days to hear back from them, in which they send you a letter in the mail. Part D penalty. If you're a person who does not take a prescription drug program when you're first eligible, or you don't have the Veterans Administration or an employer group plan where you're covered, and it's considered credible drug coverage according to Medicare guidelines. And let's say you go without a drug plan for a few years, and then you go ahead and enroll into a drug program, Medicare is going to opt for the question to say, did you have coverage between this time and this time? And if you didn't, they're going to implement a penalty. It's 1% of the national average. Basically, it's about $4 a year multiplied by as many years that you were not enrolled. They take that total and they will add it onto your plan premium, and it does go with you the rest of your life. So we always encourage people to take a drug program because you don't know what will happen in the future, and there are only certain enrollment times for this, so you don't want to be stuck mid-year not having drug coverage and having to pay for medications out of pocket either. Additional benefits that are not covered by Medicare, routine vision. On all of our plans, you do get a routine vision exam for $0. You have a $300 per year eyewear benefit as well on all 4 plans. For routine dental, as I mentioned, you can use any dentist. If they are willing to bill on your behalf, we would gladly pay them. However, they may have you pay up front and then submit for reimbursement. You have up to $1,100 on the basic plan, $600 on ultimate, classic is $850, and the plus plan is $1,150. For routine hearing exams, if you go outside of the company that we were using called Amplifone for discounted hearing aids, you do get a $100 allowance on all 4 plans per hearing device, and it's every 3 years. If you go through Amplifone, they do provide discounted hearing aids as low as $595, but the cost can go up. It just depends on the device that you choose. And then the gym memberships through Silver and Fit are available for all 4 plans through participating facilities, no cost gym memberships. Over-the-counter items are through Optum RX. They will send you a catalog and you can order by phone, by mail, or online. You will also receive a debit card with the loaded amount according to the plan, and the benefit is per quarter. So if you don't use it, you will lose it. So keep that in mind. But the basic plan has $75 per quarter, ultimate and classic are $50 per quarter, and the plus plan is $75. For the companion care service, we have through Papa Pals. There's 40 hours per year that you're able to call in and ask someone to do some light household duties, maybe take you to the store or a doctor's appointment. You can always call them just to see what their capabilities are, but you have 40 hours that you can use in the year. And then meals are delivered after an inpatient stay, or if you're considered to be an observation, they do. Meals on Wheels brings you up to 10 meals after that, so you can focus more on rehabilitation rather than having to cook for each meal. When it comes to Medicare Advantage enrollment periods, there are several different election periods. So the initial election would be for those that are turning 65. You have 3 months before, the month of, and 3 months after your 65th birthday. So initially 7 months to make that decision. Once that passes, every year through October 15th through December 7th, you have the ability to make changes to your plan again for the following January. And then January 1st to March 31st, they give you one more opportunity through the Medicare Advantage open enrollment period. If you decided that you wanted to maybe go up a plan, down a plan, you can make that change one more time. Special election periods would be for those that are losing employer coverage. If you worked beyond age 65 or your spouse did and you have coverage through the employer and you're going to lose that. If you move in or outside the plan service area, or if you qualify for Medicaid or that extra help that I talked about with applying through Social Security, you have the ability to make changes through the year as well. Some important information, we do care about preventive services and health and wellness, like your annual wellness visits, flu vaccinations, mammograms, PSA testing. Those things are covered as long as there's no medical diagnosis there. And there are, of course, services that aren't covered by Medicare. And that would be like full-time meals being delivered to the home, full-time nursing, cosmetic surgeries, things of that nature. Primetime has a disease and case management program, which if you have congestive heart failure or diabetes, they're there to help you and make sure that you are managing your illnesses as best way possible. Case management programs, if you need to, have some communication back and forth between the physicians and maybe you're going out of network, they're there to help you do that. Enrollee rights and responsibilities, just making sure that you show your Primetime card to all doctor, hospital, and pharmacy visits so they know who to bill. Notice the privacy practices. HIPAA's been long-standing, and if you would like anyone to come or call in, ask questions about your account, we need to have a letter in writing on file. You have the ability to file a grievance or an appeal based on medical and prescription claims or any experience that you have that could be negative relating to your health care. We also have multi-language interpretation services, and we do not discriminate based on race, color, national origin, sex, age, or disability. Our Plan Star rating for 2023 has been a 5-star rated plan. And Medicare evaluates these plans on an annual basis. For more information regarding that, you can visit www.medicare.gov. This is the second year in a row. Hopefully we'll have it for the third year coming up, but it just shows our dedication to excellence to our members. When it comes to enrollment into Primetime Health Plan, there are several ways to do so. You can enroll online at www.pthp.com, where you will receive a confirmation number right away. You can mail in the enrollment application by asking for a packet to be mailed to you. It's automatically in the back of that brochure. You can drop off that application to 2600 6th Street by office hours, 8 to 4:30, meeting with someone at the front desk, or there's a drop box outside. And you may also enroll through Medicare.gov. The billing options are spelled out on the application. You may receive a direct bill, which is due every month on the 15th. We can take it from a checking account. You can have it taken from your Social Security check, which it may take some time to get that approved. So as that takes some time, they either may bill you or it could come out like a double payment when they do approve that. You may also go on to the Primetime Health Plan website, create a member account, and pay online securely. Once we receive the application, we will send you a welcome packet within a week. 2 weeks later, you'll have your identification card, unless you are enrolling into the annual election period in which it's a January 1st effective date. Typically, we send out a mass mailing of cards in December. And then if you work with an agent or a broker and they help you enroll into Primetime, you need to be aware that they will be compensated. It does not change anything for you in the way of premium, co-payments, anything like that, but you just need to be aware. So why would someone choose Primetime? We really pride ourselves on the local quality care and the access to the personalized customer service that we offer. You have the one identification card. The care coordination services behind the scenes when you need them are the best, and in the sense of making sure that you're getting what you need. And we offer in-network benefits for over 50 hospitals, including Cleveland Clinic and University. Telehealth services, including Altman Now, which is urgent care through telehealth. No cost Medicare education. We release this information every year. You have worldwide coverage for urgent and emergency care, and Silver and Fit, the fitness program at participating facilities. Lots of different reasons why you could choose Primetime. So how to know which plan is right for you. You'll review the plan options, making sure that you're comfortable with the co-pays that are involved, verify that your providers and pharmacies are in the network, and reviewing the formulary to make sure that your prescriptions are covered and you understand the tier system. If you have questions regarding prime time and which we can help you understand your benefits more or the situation, please feel free to give us a call at 330-363-7407 or 1-800-577-5084. TTY is 711. Monday through Friday for walk-in hours, we are open 8 a.m. to 4:30. The call center is open as of October 1st through March, 7 days a week from 8 a.m. to 8 p.m. This concludes my presentation about Prime Time Health Plan for 2024. If you, again, have questions, feel free to reach out to one of us, and I just appreciate you taking the time to listen today. Thank you.